Yes, this is my presentation and what is actually a case presentation. And we can go on to the next slide, please. So last clinic and during our February clinic, we sent you the survey and we talked about this. We talked among each other. How can we as a team, how can the Echo Autism community, being the Echo Autism community from the US, the World Echo Autism community, and we as the Echo Autism Clinic here, be most supportive of you as a provider? What can we do to help you? And this literally is something that came from one of our participants, and they said, perhaps we can get a symptom overview. So this is what Sarah was exactly talking about those 2 points where that you can distinguish. During some of the clinics and a checklist, some type of a checklist, so we can know whether it is autism we're dealing with or not. So again, what Sarah pointed out is that at the end of our and after when our clinic ends today, we will send you, along with the survey, we will send you those resources where you will actually review those checklists that are used. Next slide, please. So what is a case study and what are the benefits that the providers, so being the therapists, the special educators, mainstream educators, physicians, doctors, pediatricians, even parents get from? What is the goal of this case presentation and how do you present it effectively? So these are the questions that we're asking ourselves. Next slide, please. An Echo autism study basically is a detailed study of an autistic person. It could be child or an adult with a particular medical, behavioral, or educational problem. So they could be struggling at school with behaviors. They could be struggling at the doctor's appointment, maybe at a dental appointment. They are struggling at home. So the case study is used basically to as a tool for the provider to basically describe the problem, and is presented, can be presented by anybody who is either a caregiver of any type. You're a caregiver if you're a family, if you have a family member of someone who's with autism. You're a provider if you're a therapist or physician, or if you're an educator, mainstream or special educator. And it is designed to give the one that is presenting the opportunity to ask the team of experts a particular question that worries them about the child. So, for example, it could be a question about a physician, about a medical need. It could be a question to a psychologist on the team about a certain behavior. It could be about a feeding problem. It could be about development of speech and language. So anything. And as a result of this, once the presenter presents their case and describes what they are faced with and a problem that they cannot solve, then we as an expert team talk about it during the clinic here. And we also provide you with a written summary and our recommendations at the end via email to all of our participants. But what we want to also reiterate here is that we learn as a team. And once we get to those case studies, which will happen next time, I believe, is that once we identify a problem, we talk about it, and we talk about a particular autistic individual, a child or an adult. We all engage in this conversation. So it's not just me and Sarah talking. or the experts talking. It's all of us talking and learning together. And this is how we're creating access to this high specialty care within the local community. Next slide, please. So this is just to show you just what the case presentation form looks like. This is our case presentation form, and we will be sending it out to you just in case you would like to, if you would like to present a case to us, but you will have our help mentoring along the way. And let's say, even if you don't feel like presenting it, you can send it to us and we can present on your behalf. But basically, you provide as much details about your child or your client or your student as you can. And this is a very detailed summary. It's about 12 pages long, but they are submitted to us about 2 weeks prior to our clinic. So we have time to work with you and to basically get to all your questions. Next slide, please. So I just wanted to talk about the very important guidelines that we have to be mindful of. Patient, child, family, privacy is number one here. So we receive your case. When we receive it, we will email you with a confidential patient ID, which will be the ECHO ID. And this ECHO ID must be utilized when we are identifying or talking about your patient during the clinic. And we must know that our case consultations do not create or otherwise establish a provider-patient relationship between us and the patient whose case is being presented. So we just wanted to make sure that what you present here is safe, patient privacy is protected, you're assigned a provider ID number, so no names and no other, anything is basically disclosed that would jeopardize the privacy of your patient at all, or their family. And obviously, as we all know, as health care workers, as teachers, as families and parents, we this message, this information is privileged and confidential, and we honor this, and it's highly important that you feel safe and confident in presenting. Next slide, please. So how do you write it and how do you present it effectively? Of course, it's a step-by-step process, and it looks worse than it actually is. Once you start to fill it out, it just flows. So the path is already formulated for you. It's the form that we have created. The step 2, which is the interview preparation, is basically, again, you're writing in the form. So you're preparing this form for us to look at and to present it to your colleagues and to the people, to your members, your friends in the ECHO clinic. The step 3 is that you want to gather as much information as you can. So if there's something you didn't know, ask the parents if they're available, ask the educators if you can, ask the doctor if he is available. So you really want to have as much information as you can in order to be able to make this portrait of this person that you will be representing and the problem that is, let's say, really creating an obstacle to your work and is an issue for the family and is a big problem for your study. So once you have that, you start writing it, you write it, and you send it to us. Next slide, please. So what are the benefits and what is the goal of these studies? Is that any presenter any member, any of you can present their own case study. And it's also an opportunity for you to practice your teaching, your talk giving or didactic skills, right? And it's also, I think, most important that you are getting with this real-time advice from autism experts about your patients or your students. And after we have talked about that, you also get written recommendations for the issues that were presented in your case, or in the case study, I should say. Next slide, please. And thank you again. This is the call for action, which means that basically this is the way how you can reach us. We have a YouTube studio that is, I believe we did not list that link on here, but all of our sessions are recorded. So if you're interested in reviewing any particular ones, you can always go back, learn, relearn, or review and give us suggestions. So thank you very much for your patience. It's, I think, not easy to talk, but I think it's harder to listen. So we had the easier role here, and now you have an open mic here from us, and we can't wait to hear from you. So whoever would like to address, speak up, please do. We can't wait to hear from you.